Good afternoon, everyone, and welcome. I'm so glad you could join us today for this important conversation about ACA Open Enrollment. My name is Jennifer Faraday, Head of Communications here at Modera, and I'm excited to introduce another webinar in our Beyond the Plan series. As you may know, in addition to our investment webinars, where we offer perspectives on the economy and the markets, we also provide education on related topics such as health and retirement decisions. And we did one earlier this year on cybersecurity and many other topics that emphasize our holistic approach to your financial life. And if you're a Modera client, you know that we believe that our role as your advisor is bigger than just managing your portfolios. Of course, that is an incredibly important component of what we do, but so is managing and offering guidance on topics such as the one we have today, which is healthcare coverage. So on that note, I'm very pleased to introduce our guest speaker, Cole Craven from Move Health, an organization that we partner with for healthcare planning. Over the next 30 or 40 minutes, Cole will walk you through important areas of ACA, including how it works, the types of plan options available, and how you can potentially lower your fixed healthcare costs and really optimize your coverage during enrollment. As with other presentations, we will have time for questions and the recording will be available to you. So with that, I will hand it over to Cole.
Awesome. Jennifer, thank you so much for having us. I'm going to get my screen shared here and get ourselves into presentation mode, but really looking forward to sharing with you all today. Really enjoy working with Modera advisors and clients alike. And so without further ado, we'll dive right in and I will start presenting my screen. So everybody should be able to see this ACA Marketplace Open Enrollment. And so again, Jennifer introduced me. I'm Cole. I'm here at Move Health. I'm the co-founder and head of growth. Which means I get to spend a lot of time with clients and advisors learning about their experiences and, talking about why we started Move Health, which a lot of times is, hey, we're getting ready to retire early. What are we going to do for health coverage between now and Medicare? Hey, we're getting ready to transition to Medicare, or we want to launch a business, but health insurance is that one thing that can kind of be a sticking point. And so that's really what we, wanted to start Move Health to solve that problem alongside advisors and their clients. And so, that's a little bit about Move Health. We're Indiana, headquartered. So I live in Evansville, Indiana, Southern Indiana. Great place. If you've never been here, I say it's a great place to raise a family. I wouldn't make a trip for it, but Marketplace Open Enrollment is what we are here for. If that's what you signed up for, you're in the right spot. So a little bit about, myself. Again, I'm the co-founder and head of growth. I think it's really important to know a few things about somebody that's presenting that's not related to just their work, right? I love my work. I love what I get to do, but outside of work, I'm getting to chase around these two boys. Are what I need to update this because it says 11 months, but today is Conrad, my son's first birthday. So we have a 1-year-old and a 4-year-old now, and my incredible wife, Megan. So outside of work, you're going to find me either chasing those two boys around. That's number one. Playing music. I'm a musician. My family is musical. I grew up the son of a touring country musician. And so fun there. We have an old house that we live in. We love doing work on that. And because of this 4-year-old, I got to experience what it's like to hit a maximum out of pocket on our health insurance, right? I was playing with my 4-year-old and tore my knee up. And so this fall, I'm rehabbing a full knee reconstruction. But I can tell you all about that as we dive into health coverage and how it works and a couple of key learnings. We've got really 3 kind of takeaways from today that we will dive into. As we get started, the chat functionality down there in the bottom, feel free to utilize that for questions if you have any that come up. There's also a Q&A option you can submit there. We'll see those. But the chat function, I'd love to know where you all are located. If you want to share that there, like I said, we're in Indiana. If we've got any other Hoosiers that are out there, or Hoosiers at heart, would love to know. But without further ado, we'll dive into the topic. So today's agenda, we're going to talk about pre-65 individual health insurance, the basics for folks, what options do folks have in the individual market? And then we're going to dive into the topic at hand that we're hearing about on the news and we're hearing about as a result of the government shutdown, advanced premium tax credit, and the One Big Beautiful Bill Act and impacts of that. And then we're going to talk about some open enrollment timelines and best practices. And we will, as always, leave some time for Q&A. So there's Joy in Maine. Looks like we got a Maryland, a New Jersey, a New York City, a South Carolina. Awesome. Good to see you all. Thanks for sharing there. And so we're going to jump right into key learning number 1, which is pre-65 health insurance basics. And this is going to be we're going to talk about this in the framing of a retiree. And so some of these options will exist only for retirees, obviously. But then also this is a good overview of folks that may be, say, a contractor or a 1099 or things along those lines as well. So without further ado, retiree benefits. These are in no particular order, but we're going to go through kind of the options that may be available to someone who is thinking about, needing health coverage outside of a job, right? Looks like we've got, there's a couple others there, Philly, Virginia, Lehigh Valley. Sorry, we play, Indiana plays Penn State this year, or this weekend, so we're looking forward to that. Georgia, in Florida, Steven's a Hoosier. Awesome. I love it. So retiree benefits. What retirement benefits? This is always something we have a conversation with as someone is entering early retirement or entering retirement. What retirement benefits may be available through your specific industry, right? The benefits of retiree benefits is these are an earned benefit, right? So typically you have a specific tenure that you needed to have worked at an organization. A lot of times you'll see this in higher education. You'll see this in unions or specific industries. If you've been at an employer for a long time, they'll say, hey, here's a retiree benefit. It may or may not include a health benefit, but make certain to check into that. Many times this can be a low-cost option when it's available, right? So specific to different industries and things along those lines. One thing that we see across the board as a con maybe is that, and something just to keep an eye on, is retiree benefits are typically getting a little bit skinnier year over year. I was just with a client earlier today who said, I retired from a large auto manufacturer. Way back in the day when I started into the pension, they said we'd have healthcare for life. That's now changed to we get a set dollar amount, right, rather than the actual health plan or things along those lines. And so always double check what those are. Your retiree benefits. It's also important to note that if you have a retiree health plan, it may be different than the plan that you had when you were at an employer. So something to note there. If it's specific to a specific employer or union or things along those lines, they can sometimes have some funky exclusions or rules in a retiree health plan. And again, these may require use of specific hospitals or networks as well. And so that's retiree benefits. That's one option. Option 2, we see this one exercised and talked about often. COBRA, right? So this is not a snake. It's the Consolidated Omnibus Budget Reconciliation Act. This was part of the Reagan administration in the 1980s, I believe 1984. Someone can feel free to fact check me on that one. But, COBRA was written into law at that point. And what this is a continuation of your employer coverage. In most cases, this can last up to 18 months where you can keep it. Times where we see COBRA, activated for someone. Someone is, a high earner, and they're not going to be able to take advantage of tax credits on the marketplace, which we'll dive into a little later. For someone who's undergoing current treatment, or if they've already met a deductible for the year, those would be things that we would look at COBRA and say, okay, what's the option there, and what's the cost associated with it? There's no change. It is the exact same plan that you have with your employer. Again, deductibles carry forward, and you know how the plan works. Typically, you've been on it for a little while. You know how your plan works, your doctors you take, et cetera. The cons of COBRA, it usually is the most expensive option. So as we look at COBRA, you are, when you take COBRA, in most cases, unless it's part of a severance package and there's COBRA subsidy or things along those lines from your employer, typically you're paying the full boat, right? So when you are an active employee of an organization, when you are an active employee, they're paying a portion of your health insurance premium in most cases. And, so you might pay $300 a month for your family to have coverage, but in reality, the plan cost is actually $2,700 a month, and the employer is paying $2,400 on your behalf. So when you take COBRA, you are paying both the employee and the employer portion. And the other piece of that is they tack on, you use a COBRA administrator, and there's a 2% administrative fee. So you're paying 102% of the plan cost when you take COBRA. Usually the most expensive option available, but again, no change from the employer coverage. Deductibles carry forward. You know how the plan works. Again, 18-month is typically how long it can last. There are rare cases where it can go longer than that. One other thing to note, COBRA and Medicare do not mix. So if we get nothing else out of this, if you are Medicare eligible, do not have coverage through a job, you need to take Medicare. Do not take COBRA. It's not considered creditable coverage for Medicare's purposes. So COBRA and Medicare, like oil and water. So that's COBRA. And feel free, if there are questions that come up, feel free to put them in the chat or ask them in the Q&A. Another option that's available is short-term major medical. This can be a good option for folks that are healthy with a short-term need between, jobs, or, we're talking about like less than a year typically where they're needing coverage. Typically, these are going to have large networks associated with them. If you're fully unsubsidized on the marketplace, high income, a lot of times these may be a lower cost alternative. And there's no special enrollment period needed for a short-term major medical plan. Now, so what that means is that coverage could start as soon as midnight tonight, right? If you enrolled into it. Now, the cons of it. Most are not Affordable Care Act compliant. And the reason that they are not is because they're not going to cover things like pre-existing conditions, pregnancy, or prescriptions, right? So I call that the 3 Ps. They're not going to cover pre-ex, pregnancy, or prescriptions. Most have some form of a medical underwriting piece to them. So these act a lot like health insurance did before the Affordable Care Act came into play in 2010. And so we'll talk a little more about the Affordable Care Act in a moment. And depending upon the state, limited terms are available, or there's no terms available, right? As an example, in New York, you cannot buy short-term major medical. Just as an example, because I knew we saw a New York that was New York that was out there. So that's short-term major medical, a small niche tool for a minority of folks. Healthcare sharing, this is another option. Again, this is very, very niche. It's a non-insurance alternative for individuals and families. And so, there's several that exist out there. Medishare is one that is the largest, right? As you think about healthcare sharing programs, maybe you've heard of Medishare. That's the biggest and oldest one that's out there. There are others that kick up and start, and typically they're going to have some form of a faith-based component to them. And they're going to say, hey, this is not insurance. We are members sharing in each other's medical burdens. The benefit of healthcare sharing, maybe some of the pros of it, is it can be up to half the cost of an unsubsidized marketplace plan. So that can be a benefit. Many times they have a large network associated with them, and there's no special enrollment period needed, nor is it taking into account things like your income, et cetera. There's not extra tax work that you have to do because you're taking tax credits or things along those lines. The cons. They may or may not be Affordable Care Act compliant. And many times these are going to operate, again, like I said, on the religious exemption as a part of the Affordable Care Act. And so that's an important thing to take a look at. And so the next piece, they may or may not be Affordable Care Act compliant. There's no guarantees, right? It's not insurance. You don't sign an insurance contract. It's healthcare sharing. So make certain that you have a firm understanding of how it works. As an example, Medishare, that is one that has existed. They act a lot like insurance. They run over $1 billion through that program every year. Pretty big, stable, larger than many regional insurance carriers. But again, there are no guarantees since it's not insurance. You will see, smaller healthcare sharing programs, pop up and then fizzle out, and they create a headline and it's a bad experience, et cetera, et cetera. So healthcare sharing, make certain you understand how it works and you understand everything associated with it. We'll stop here because I saw one question come through. Cindy said, do you have a contact number? I cannot stay for the entire call. We'll make certain that you receive that as a part of the follow-up. Modera advisors actually make the connection to us here at Move Health. Cindy, great question. So last but not least, we'll talk about the Affordable Care Act, and we're in the enrollment period for the Affordable Care Act marketplace plans. You might hear these referenced as the ACA. You might hear them referenced as Obamacare or the marketplace, right? This was written into law in 2010. We'll talk a little more about that. But the benefit of Affordable Care Act marketplace plans, they are guaranteed to cover pre-existing conditions. They cannot, insurance carriers cannot rate you up or decline you or make things more expensive for you if you are, have a pre-existing condition. So if you are undergoing current treatment for something, you can get a marketplace plan with a qualifying life event to enroll into coverage, and it will begin paying or covering that pre-existing condition. Rates are based on age, location, smoking status. If you are someone who has flexibility in income with subsidies in place or advanced premium tax credits in place, it can many times be the most affordable option. This also allows what I say is massaging of MAGI to help lower premiums. And so in this instance, what that means is that if you're someone who has flexibility of where dollars come from, many times an early retiree may have this, your financial advisor can work alongside of you to reduce your modified adjusted gross income to take advantage of these things called advanced premium tax credits. And we're going to do a deep dive on those here in just a moment. The downsides of a marketplace plan, they may have restrictive networks. So this is one thing you hear is a kind of a drawback of marketplace plans. They might have restrictive networks. They do require a little extra legwork during tax time. You get a form called a 1095A, which then turns into IRS form 8962. And you have to file that basically saying, here's what I said on my application I was going to make. If I'm taking tax credits, here's what I said I was going to make. If, and then they're saying, here's what you actually made, and then the tax credits reconcile. So it can have higher out-of-pocket costs than you might be used to with an employer plan as well. And so all good questions there. Lynette says, I'm 79 on Medicare. Will any of this webinar be for me? This is specific to pre-65, open enrollment marketplace. We did a webinar, Lynette, great question. We did a webinar previously on Medicare with Modera. And so you might reach out to your financial advisor and request that. Christine, one of my colleagues and business partners, did that one. She did a great job. And so you might check that one out. Todd said, are there other better options provided through a health insurance broker? Love that question, right? Before we get into the advanced premium tax credit deep dive, I'll answer that question, that says, are there better options provided through a health insurance broker? So Move Health can operate as a health insurance broker, and we can do that. Todd, what I will tell you, and this is what I tell our advisor partners and what I tell clients when they ask that same question, is related to that there's no differentiation in product across the insurance space, right? Any insurance broker that would say, hey, I've got this great, black box of plans that I can open up and you can take a look at, and they're all PPO networks and really inexpensive, right? If it sounds too good to be true, many times it is. Working with a broker makes certain that you have a view of all of the options, right? Whether it was, 1, 2, 3, 4, or 5 that we've kind of gone through here. It's a really great question, but you're not going to get a better premium by working through one broker over another. Those rates are set and approved by the state's Department of Insurance. And they should have all of those options. A good question to ask a broker is, are you captive, or are you looking at all of the options available to me, whether that be on the marketplace or off marketplace, et cetera? So great question. Good thoughts there. As we continue on, most folks, believe it or not, the Affordable Care Act has been around since 2010, the largest piece of healthcare legislation ever. Most people don't understand that health insurance is guaranteed issue. Like I mentioned, if you buy or purchase health insurance through the marketplace, it's guaranteed issue. So you could be undergoing current cancer treatment or have had a heart attack 2 weeks ago. If you have a qualifying life event or it's during the open enrollment period, you can enroll into marketplace coverage that will accept you. You can't be denied because of coverage, because of a pre-existing condition. The only thing that's really kind of health related that you can be rated up for is tobacco use. If you're a tobacco user, that coverage can cost a little bit more. There's some regulations and numbers on how high a carrier can take you up on that. And then coverage on the marketplace is available through major insurance carriers, right? It's going to depend on the state of what carriers participate in that specific area. Steven says, we're snowbirds. We spend 5 months in Chicago and 7 months in Sarasota. What are our best options for coverage? Steven's hard question to answer. Feel free to send that through to us or send it through your advisor, and we can answer that question there. At a glance, how we would think about that at Move Health is we would say, okay, you spend 5 months in Chicago, 7 months in Sarasota. The next question is going to be, what option do we need to look at? Do we have COBRA as an option? Do we need to look off the marketplace? Do we need to look on the marketplace? we would need to look for a plan that would have coverage in both of those places, because assuming we're seeing doctors there, so we need to look for a wider network if possible. So Illinois, if that's your home residence, the good news is Illinois is one of the states that Blue Cross Blue Shield of Illinois, I just know this offhand, offers a PPO network. Which allows you to see both of those, doctors in both of those locations. Key learning number 2, we're going to dive in specifically on the Affordable Care Act marketplace and talk about advanced premium tax credits. And so as we go through here, what are advanced premium tax credits? Well, they're a federal subsidy that was created under the Affordable Care Act for plans purchased through the marketplace. They're advanced is why they're called this, because they're applied before taxes are filed, and they directly lower your monthly premium. And so somebody would come to me and say, how does an advanced premium tax credit work? Well, this is how, right? You say there's $1,000 gross premium for the plan, just using round numbers, $1,000 gross premium for the plan on the marketplace that you would like to enroll into. When you enroll through the marketplace and elect tax credits, you say, here's what I expect my income to be. The federal government then says, based upon your income, we are going to subsidize that, by $500 a month. And so that tax credit is applied directly to the premium. And so the federal government is paying the insurance carrier $500, you're paying the insurance carrier $500, and together that creates the gross premium of $1,000. It happens not on a reconciliation basis. You don't get it all back at the end of the year. It happens in the month because they're applied before taxes are filed. So that's the advanced portion. And I'll tell you, the reason that these advanced premium tax credits existed was because when you imagine when you create a guaranteed issue scenario, like they did with Obamacare, 2014, the marketplace began. January 1st, 2014, health insurance premiums went up 300% overnight. And the reason because of that is all of these, actuaries that, live, eat, sleep, and breathe numbers and risk analysis at these insurance carriers were saying, wait, if we want to participate in the marketplace, we have to accept everyone. Well, we're going to put everybody in the highest risk pool, right? And so the Obama administration knew that this would take place. This is why the Affordable Care Act marketplace, was created to offer coverage to folks with pre-existing conditions. But the advanced premium tax credits were there to offset that, right? So we knew that there was a cause and effect. We create guaranteed issue scenario, premiums are going to go up 300%. The federal government says, we can work on that. We're going to create these advanced premium tax credits to offset the cost. It also encourages more healthy individuals to enroll and balances the risk pool, and ultimately reduces the number of uninsured Americans by saying, hey, we can make your health coverage more affordable. And it's funded through the federal tax system. And it is a refundable tax credit. We'll talk a little more about the mechanisms there. So how do they work, right? You estimate your household modified adjusted gross income for the coverage year. You might hear me say MAGI or MAGI. That's what I'm referencing, modified adjusted gross income. And the marketplace calculates your expected premium contribution based on a sliding scale. I'll show you that in just a moment. Again, the federal government's going to pay the difference between your expected contribution and the cost of a benchmark plan, and the credits applied to lower your monthly premiums in real time. So that's how they work. The next question that we get is, who can get an advanced premium tax credit? Well, you may qualify for an advanced premium tax credit if you enroll through a marketplace plan on exchange, right? This is important. You can't apply your marketplace tax credits or advanced premium tax credits to your employer plan or to your Medicare or things along those lines, right? You enroll through a marketplace plan on the exchange, right? Some states have healthcare.gov. Most states have healthcare.gov. Some states, like New Jersey, has its own marketplace, Get Covered New Jersey or Covered California. Get Covered Illinois, they're the newest state-based marketplace. So you enroll through the marketplace and elect tax credits. You have to have a household income between 100 and 400% of the federal poverty level. And we're going to talk about the subsidy cliff here in just a moment as well. And you must not be eligible for other minimum essential coverage like an employer plan, Medicare, or Medicaid. So if you don't have coverage through a job, Medicare, or Medicaid, and you enroll through the marketplace, you could get a tax credit on the marketplace if your income's within a certain window. And so we'll keep moving along here, and we'll talk about the timeline of Affordable Care Act tax credits. So like I mentioned, January 1st, 2014, the marketplace was born as a result of the Affordable Care Act. Coverage is guaranteed issue, and there were subsidies or those advanced premium tax credits for folks within 400% of the federal poverty level. We went through 7 hunky-dory years where the Affordable Care Act continued to grow and scale. In March 11th, 2021, the American Rescue Plan Act was passed. This was a COVID relief era bill. And what it said is we're going to make those advanced premium tax credits available to those that are over 400% of the federal poverty level. And it limited basically the plan premiums to no more than 8.5% of modified adjusted gross income. And then those were set for a year, right? Those were set to go for a year as part of a COVID relief bill. The Inflation Reduction Act came in August 16th of 2022, and the American Rescue Plan Act subsidies for those that are over 400% of the federal poverty level, those were continued through the end of 2025. And if we look at a calendar today, we are in the fourth quarter of 2025, November the 6th today as we're recording this. And on December 31st, 2025, the American Rescue Plan Act enhanced advanced premium tax credits do expire. They're set to expire. If you know, if you've watched the news, or if not, you may be under a rock, but the federal government is shut down right now. And a portion of that is the argument around these enhanced advanced premium tax credits. And so I'll show you how tax credits have worked from March 11th, 2021, all the way through December 31st, 2025. You're going to see a chart here. So for some of my engineers and number people, this is for you. Right now, tax credits work on a spectrum, with plan premiums being adjusted and subsidized down to 8.5% of modified adjusted gross income or less. So as we look at this, and let's say it's an early retiree couple, a household size of 2, we can take this going all the way up here to the right. Here's 400%, $85,000 roughly in modified adjusted gross income. They would say, okay, we're not going to spend more than 8.5% of our modified adjusted gross income on a health insurance plan purchased through the marketplace. We will be subsidized down to that level. As income goes down, your expected level of income contribution goes down as well. Important to note that advanced premium tax credits on the marketplace are not looking at your assets. They're looking at what your modified adjusted gross income is for the current year, right? So as we're helping folks right now, to enroll into coverage for 2026, we're asking, what do you expect your 2026 modified adjusted gross income to be? And they tell us, and then we say, okay, based upon that, you may not get a tax credit if you're over 400%, or if you are, you will receive that. And then we will tell them, hey, here's your expected level of income contribution. Now, there are folks that can be multi-millionaires, high net worth individuals that have very low modified adjusted gross income, whether that's where the dollars are coming from, maybe they have cash reserves that they're tapping, things along those lines. Your advisor would help you with this modified adjusted gross income number. But we work with multi-millionaires that have a modified adjusted gross income as a couple of $32,000 a year, right? Or things along those lines. And so they're paying $0 a month for their health insurance right now. This is tax law. This is a way that you can make this work. Right now, there are tax credits that are available for those over 400% of the federal poverty level. And so that's important to note right now. Now, moving forward, as of right now, November the 6th, as we think about that, the federal tax credit for those over 400% of FPL is set to sunset, and it's going to go back to something that looks like this, right? When the income cliff returns, which was this was called the income cliff. It was deemed, somebody in the news deemed it the income cliff, where they said, if you go over 400%, you lose all of your tax credits. Just recently I was with a client in Kentucky, and they were teetering right on this line. And for 2026, as far as income goes, and they said, okay, if I make more than that in modified adjusted gross income next year, say I'm going to make $80,000 and I accidentally go over that, how much does that cost me? Well, for that couple, if they're at $80,000, they were receiving for next year around $900 a month in an advanced premium tax credit. So if they go over that, they will be forced to pay all of those advanced premium tax credits that they received throughout the year back. And those do reconcile at tax time, like I mentioned, some of that tax legwork. Not a lot, but it is, for that. And so it can be a meaningful thing to go over that if you're expecting to stay within 400%. So when the income cliff returns, as of right now, it is expected to occur where the enhanced advanced premium tax credits, Those that are over 400% will not be able to receive those tax credits. They'll need to be within this realm here in order to take advantage of those when the income cliff returns. So what we're seeing across the board is for those that were over 400%, we're seeing two things happen. One, we're seeing premiums go up, right? Because they're no longer receiving the tax credit. And so someone who is receiving, let's say, $1,000 a month in a tax credit, they can expect their premium to go up by $1,000 a month next year, right? If they're receiving that in 2025, they will not receive it if they're over 400% next year. So if you are one of those folks that's over 400%, talk to your advisor and see if there's a way to get within 400%, or like we tell people most of the time, just make certain you plan for it, right? You have a good plan to cover those costs. The good news is, for those that are on the marketplace above 400%, there's 25 million Americans that are on marketplace coverage, above 400% of the federal poverty level. There's 1.5 million within that camp. So 25 million that are on the marketplace in total, only 1.5 are above 400% of that threshold. So it's a de minimis impact, and it appears from our perspective that there is bipartisan support to take those enhanced advanced premium tax credits and actually move them forward and extend them for those that are over 400%. The argument at this point is between where it's being funded from and how it's being funded. But as far as a government budget line item, it's not a massive line item. There's 1.5 million Americans that will be impacted by this 400% income cliff returning. So that's when the income cliff returns. Happy to answer questions on that as we get through there. A couple of things, if you're on the marketplace, the One Big Beautiful Bill Act did make some changes to HSAs. So what didn't happen? We didn't get increased contribution limits. That's not something that happened. But a couple of things that did happen. The big new one here is that all bronze level plans on the marketplace next year become HSA compatible. Previously, this was not the case. So if you are on a bronze level plan, you can contribute to an HSA, no questions asked. Another one that's new, direct primary care. Maybe you see a concierge doctor that you might pay a monthly subscription or fee to be able to see direct primary care. That's now an HSA eligible expense. So you can now spend HSA dollars for direct primary care bills and for those, so that's kind of that subscription. So direct primary care. There's also an extension of high deductible health plans. HSA eligible plans can cover telehealth services before the deductible is met. So those are some of the changes to HSAs. Happy to answer questions on those as well. But we're going to move into some key dates, important timelines, and enrollment period details. So key dates for the marketplace. Open enrollment period for the federal marketplace runs from November 1st through January the 15th. Be certain that you enroll by December 15th for a January 1st effective date, by January 15th for a February 1st effective date. And so December 15th, you need to enroll by then if you want your coverage to start on 1/1. If you need it to start on 2/1, you can enroll by January the 15th. States with their own marketplace will have differing open enrollment timelines. A good way to think about it is if you get it taken care of in November or early December, you're in a good spot. Check your state's website. So as an example, covered California or New York, New Jersey, Maryland, et cetera, right? What you can do during this time is enroll or change your entire health plan. So if you are on COBRA, right? And we'll talk about this, on a different slide. If you're on COBRA and you might want to look at the marketplace, this is the time that you can make a change to your COBRA coverage without a qualifying life event, right? Or go to the marketplace without any questions asked. You can drop your COBRA, pick up a marketplace plan for the new year. So you're going to change or enroll into for the first time a health plan through the marketplace. Here are things to verify during open enrollment period. A quick checklist. Provider networks. Are your doctors in network with the plan? Networks can change every single year. Sometimes insurance carriers and provider networks or hospital networks will use this as a bargaining chip. Be sure that your providers are in network, right? There's a big shakeup in Minnesota as an example for provider networks in Mayo Clinic up there, right? So be sure you're checking those things. Drug formulary. Are the meds that you take covered? Make certain that the medications, if you've changed medications or had a new medication introduced this year, double check that those are covered. Drug costs, if they are covered, are they affordable, right? What does that look like for you? Is there a lower cost alternative, or we should look at rate increases? HSA eligibility, if this is a part of your financial plan with your Modera advisor, can you contribute to it on the plan that you'd select? make certain to consult your advisor, on that as well, if that's a part of the plan. Out of pocket, maximum, and deductible. Do you understand your full exposure? This is an important piece of the puzzle. Health insurance, we believe, should be reviewed at least annually, right? And so really, really good, checklist here of things to verify during open enrollment period. If you are someone that, is asking, should I review my coverage, right? Yes, if you're a pre-65 retiree, maybe you're a small business owner, or someone responsible for buying your own health coverage. If you're on COBRA and want to explore ending it early, right? This is the time of year. Like I said, many choose COBRA a lot of times due to administrative ease and familiarity, but it can be expensive. And so if you're someone that may be able to take advantage of the tax credit or want to look on the marketplace for coverage, this is the time of year to do it. If you've had a recent change in, your health, your location, your income, double check it and review your coverage. If you're evaluating HSA compatible plans, make certain that's the case. Or certainly if you are accessing an advanced premium tax credit right now, whether you're over 400% of the federal poverty level or within it, make certain that you are doing a close review of your coverage. One of the things that I feel passionately about is helping improve healthcare literacy. And, I think that a lot of times folks just say, well, this is my coverage and this is what I've got. Our goal when working with a client is that they're going to understand, what their cost is when they go to the doctor's office, right? And not many people can answer that question, as an example. And so, that's what you should review during that time. So what are your next steps, right? Next steps, Modera's partnered with us to do an annual review for you, right? If you're someone who is needing 1/1/2026 coverage, January 1st, 2026 coverage, make certain to touch base with your Modera advisor and they can start that process. I guess we really liked ends here. We added a couple of extra ones to the annual review, your annual review. But the health plan analysis that we complete on your behalf is going to review provider networks and HSA eligibility and drug coverage. We're also going to look at, is the carrier in that area stable? Have they been around for a while? Are they new to the market? Are they coming in, as the low cost leader? What does that look like? The good news is we can change these, every year as necessary. What about drug costs, et cetera? So we do that. We create a health plan analysis on your behalf, and then we can actually help facilitate the enrollment and implementation as well, and act as a broker of record on that if appropriate. But if you're someone who's trying to say, should I look at COBRA or should I look at the marketplace or off marketplace options, feel free to reach out to your advisor. They can make a connection to us at Move Health. We also do the same work in the Medicare space. And so I know that there was a question in the chat about Medicare. We had it looks like it's on the client resources under webinar events if you want to watch the Medicare one that my colleague Christine completed just a month ago. So that's what we do. And so, we've got to thank you for attending here. And so I wanted to grab questions as they come through here. It looks like Ed had one here in the chat. Thank you for that. Ed said, for ACA plans, are there exceptions that we should be aware of where total out-of-pocket costs could be exceeded, assuming that all providers are in network? Really good question, Ed. If providers are in network, you're using in-network providers and taking covered prescription medications, you will not exceed your maximum out-of-pocket cost. That's what that's there for. So typically the way that it will work is, say you have a challenging medical year, and let's say we have a $5,000 deductible and a $10,000 maximum out of pocket, right? Sometimes you'll see the deductible and maximum out of pocket are different. And we'll say, for the sake of this, that we're on a 70-30 co-insurance plan. The way that this works is that you hit your $5,000 deductible, insurance then begins paying and sharing in those costs alongside of you. They share and pay 70%, you pay 30% until you've hit your maximum out of pocket of $10,000. If you are using in-network providers and taking drugs that are covered on the formulary, you will not go above and beyond your out-of-pocket costs. That's a great question. Ed, one thing to note on marketplace coverage and on health insurance in general, typically you have both a individual deductible and a family deductible, right? So in my case, I have a $5,000 individual deductible. But we have a $10,000 family deductible, right? And so you meet that as a family, et cetera. So the person can meet their $5,000 deductible. Example, I had my knee reconstruction. I met my deductible, $5,000, and then then you can look into going into co-insurance, and then anything else that maybe other family members had would be subject to that family deductible. So really, really good question, Ed. Todd says, how prevalent are EPO plans? Do any of the ACA plans in New York have out-of-network coverage? Todd, really, really good question. That can depend on down to the zip code. There are, it really depends on specific things. An EPO network is an exclusive provider organization. It's a little less restrictive than an HMO, a health maintenance organization. So a little less restrictive, doesn't require a referral to see a specialist. An EPO plan, they exist on the marketplace in New York, but an EPO does not grant, out of network coverage in most cases. So always looking to make certain that, and for ease of use, it's always good to make certain that your carrier has your providers in network from the jump. That's the easiest way to do it. New York is a challenging state for that, though. I can share that with you. I know that from experience. And so, good question, Todd. Any other questions that are out there? Jennifer, did you have any that you wanted to lob at me?
I think that's all we have for the moment. I did want to thank you, though, Cole, and of course, Move Health, for all that. I mean, wow, that was a lot of information. I mean,
for sure.
As you can see, healthcare is a very complex topic, and you really helped break it down and really the essential information that we needed to know specifically for this open enrollment period. As well as I really appreciated also just you taking us through the questions and the process you would use to just take someone through what best plan in the selection process. So that said, if you still have questions that we were not able to answer today, please reach out to your advisor, because as I mentioned, this is a very complex topic. And also think about this information not only for yourself but for loved ones. I love that checklist that you had at the end, because a lot of these situations, they change, and so you might be fine now, but you can change, or again, someone that it might be more relevant. So please take a look at that. For our clients and guests who have attended, as always, we are grateful for your participation. So if there are no more questions, this recording will be available in the next few days. Thanks again, Cole, and thanks everyone for attending. Be safe.
Of course. Thank you all.